Good morning, my name is Dr. Clark. I'm the Program Director for the Masters of Athletic Training Program. This is Luke Cody. Luke is going to present on virtual reality and therapeutic intervention. So Luke, have at it, sir.
All right, thanks for coming, everybody. I didn't actually expect this big of a crowd, but that's pretty cool. So like I said, my name is Luke Cody. I'm in the Master's Program for Athletic Training. And I'm going to come up here and talk about virtual reality being used as a therapeutic intervention. So to start, what is virtual reality? I mean, at this point, if you hadn't heard about virtual reality, you're living under a rock and definitely not in the metaverse. So how does it tie into being a therapeutic intervention? Well, I started with my search strategy. I don't know if y'all have heard of PICO. It's an interesting, or not interesting, but a nice little tool, acronym to help you search for stuff on the internet and databases. So my participants were athletes with physical impairments. Interventions were virtual reality exercise programs. So these VR units actually have programs that come with it. Comparison was against just therapeutic exercise. Therapeutic exercise obviously is a standard for rehabilitation. So I wanted to see if virtual reality could actually stand up to that. And then outcomes were quality physical results and increased motivation. So inclusion criteria was studies that included patients with physical impairments. Now I said physical because a lot of VR therapy included mental. A lot of research, but it doesn't really apply to our program as much. So obviously I also wanted it in English language. I only speak English, and the studies conducted within the last 3 years. That 3-year mark is pretty interesting because there's a lot of research that's been done, but within the last 3 years it's really been modified and expounded upon, and it's a lot more accredited. So exclusion, studies that focus on mental impairments, already discussed that, and then use participants in an education setting. There's a lot of VR education, motivational means, but I wanted this to be focused on rehabilitation instead. So, my evidence quality assessment, I use Pajo scale and stroke checklist. You'll see that as I go through. And then the results of the study, I chose 5 studies. 4 of these use therapeutic interventions, 3 compared physical comparisons, and 1 was motivational. And then I had 1 that used VR to assess skill in sports. So speaking of assessment in sport, my first article here by Atlas, he used VR actually to create live scenarios. These live scenarios, they use video and audio stimulation. These video and audio stimulation really created a sports environment for these guys. It was used a lot of like sports acclimation, and also just assess skill. Gave these guys, guys and girls, within the soccer setting, just a peek into what going back to sport actually was. So next one was, it was as you can see here, using a ProKin Force system platform that compared, it compared 3 different groups: virtual reality training, combined physical rehabilitation, and a control, which was just using isometric exercises. Improved intention, concentration, memory, and working capacity through gradual increases. The game of choice actually was a shooting game. It was pretty cool. They used the system to use lumbar side flexion and lumbar flexion to shoot and aim. And then our next one was another VR system using or increasing dynamic stability of the ankle. It used Stork test and Y balance test to assess the balance capabilities of the athletes using Nintendo Wii Fit. And the study went for 8 weeks. The control group was asked to carry through with normal activities of daily living, but the group that was using the VR, they had to go through this program that was different exercises using this board where they would just put their foot on the board and move it around. It's a pretty cool exercise. And we go into our next system, using the ProKin system. It's important to note that balance ability is closely associated with the recovery of walking and capabilities of or probability of not falling again. So this was post-stroke victims that were used in this study. Wanted to make sure that they could actually return back to activities of daily living. And then for our next one This was actually to monitor acceptance rate and motivation. So I mentioned earlier that motivation was part of the study. Wanted to see that VR actually was, keeping people interested. Because with rehabilitation, I don't know if you guys have ever been in physical therapy or any kind of rehabilitation of that sort. It's after a while it kind of gets boring, kind of gets discouraging. But with the VR, it was really used to try to help people stay in it, stay at it, and staying with it is the way you get better. So the bottom line was that virtual reality compared to other interventions is just effective physically. It was really good. I saw that across the board. Virtual reality decreases pain perception. Now I saw with my soccer rehabilitation with the ProPin system, that was a big thing where these guys and girls had low back pain, but they didn't hurt as much when they were using these systems that was used on a pain scale. And the virtual reality increases motivation with learning and during rehabilitation. So that implies that virtual reality does compare well against the other therapeutic interventions that was across the board. It didn't do any better, but it didn't do any worse. That was a big thing that I wanted to see, was that it at least was effective. And then we can use that to gauge motivation as well. So if it's more motivating and it's just effective physically, then it's a good therapeutic intervention. So here are my references. And I wanted to stop here and thank everybody for coming in. Thank my classmates for showing up. Thank my teachers for helping me out. And yeah, I don't think I could have done this without their support. But with that being said, any questions?
I have so many questions.
Okay.
So you talked about the different systems. The Wii was one, but on a few of the others, I don't know if you really listed a specific device. Are we talking about something like the Vive or the Oculus or like what? Do you know about that?
Yeah, actually the Oculus was used a lot as virtual headsets. So some systems used just a board and they had a screen. Like when I said the Nintendo Wii Fit, that's actually what they used. They used Wii Fit and a console and a TV.
Board.
Yeah, exactly. And then with a lot of the ProKin systems, those were headsets, and they use those to simulate free 160-degree experience.
Sure. So, okay, it seems like weight would be a big issue with a lot of these because, like, if it's for exercise, it needs to be both wireless and light. Was that one of the challenges or one of the things that they prioritized?
Well, a lot of the times there were athletes, so you have a lot of fit individuals. But with the post-stroke patients, that was an issue. It wasn't full weight bearing.
Are they sitting?
Mm-hmm.
Okay.
Yeah. Some would sit, some would even have, like they would sit and have it on the floor, or it could put full weight in a chair. So.
Okay, and last question for me at least, I'm sure other people have one, is when you talked about physical therapy and trying to keep them like sort of occupied so they're not terribly bored, is the VR being used more to sort of distract them, like they're doing something else, or are they sort of recontextualizing what's happening?
No, you got it right the first time. It was a distraction. I mean, if...
So they're on the sunny beach or something while they're getting their leg...
Whatever system they're in, they're not in the PT clinic. They're not in this boring environment. They can go literally anywhere.
That was my question too. But what are they seeing in the VR when they're doing the therapy?
Did you hear about the cows?
Bawling.
They're putting goggles on cows now so they can feel like they're outside and they get more milk.
I
Did you hear
saw
about
that. I saw that. Yeah.
I was like, is it like the cows?
I did not do any research on that. But, I did see that where they're actually producing better milk and more milk. Yeah, it's crazy. So even, I should have done another slide on that. Sorry, guys.
So they're virtually grass-fed.
Right.
Yes.
We can use that conception that they are fed, right? You can make
Yeah. Are there questions from somebody else? I'm sorry to monopolize.
I have a question.
Yeah, come on.
So how would you approach a situation where if somebody's wearing a headset, so like an Oculus, for example, how would you approach someone when dealing with motion sickness?
Oh yeah, that was addressed a lot in the post-stroke rehabilitation because you have some older patients who are already visually impaired or could be visually impaired, and that was there was a screening in a lot of the studies that I saw where if there were people who were getting motion sickness, then they were excluded from the study. That was across the board. Thank you.
I got kind of like a joint question.
Okay.
Do you feel how much movement was the patients allowed to have? Do you feel as if that played a role in like the decreased pain perception that they said?
Yeah, see, that's it's a tricky question because you're only going to move how much you want to move, but these systems were there to kind of push those boundaries back. If you're not focusing on so much, oh, this movement's going to hurt me, as much as, oh, this movement's going to help me beat this level of the game, then you may get more increase in flexibility or range of motion. And that was seen within, let's see, which study was it? It was the NAMI study with the ProKin system, where the low back pain, they were able to actually have more range of motion and decrease pain stimulation. So I hope that answers your question.
All right. Let's thank our speaker again.